Hey there, and welcome. Today, we're diving into a really simple blood test that can tell you a whole lot about your health. It's called the glomerular filtration rate test, or GFR for short. Think of it as a status report on your body's most important filters.
So let me ask you a question you've probably never thought about. How well are your body's built-in superfilters actually working? It's a huge deal for your overall health, and the answer starts with some amazing little organs we all have.
That's right, we're talking about your kidneys. They are this incredible nonstop purification system. Tucked inside them are millions of tiny, tiny filters, and their only job is to constantly clean your blood, pulling out all the junk and extra water that eventually leaves your body as urine.
Okay, so how do we check up on these critical filters to make sure they're doing their job? Well, that's exactly where the GFR test comes in. It's a really straightforward blood test that measures just how good a job those tiny filters are doing. So let's get into it. What is this test actually looking for? Think of it like a performance review for your kidneys, and it's really focused on one key metric more than anything else. And that metric is speed. Yep, it's that simple. Healthy kidneys filter your blood at a pretty consistent rate, but if they're damaged, that whole process slows way down. So the GFR test is basically just clocking that speed. It gives doctors a super clear idea of how well your kidneys are keeping up. All right, so who gets this test and why? Well, a doctor might order a GFR test for one of two main reasons, either as a proactive screening or as a way to diagnose a problem. So on one side, you've got screening. This is for people who feel totally fine, no symptoms at all, but might have other risk factors for kidney disease. And on the other side, you've got diagnosis. This is for people who are already showing signs that something might be up with their kidneys. Let's look at that screening side first. Here's a kind of scary fact. Early-stage kidney disease often has zero symptoms. None. That's why screening is so important if you have risk factors like diabetes, high blood pressure, heart disease, or even just a family history of kidney issues. It's all about catching problems before they get serious. Now for the diagnostic side. If you're actually experiencing things like swelling in your legs, weird changes in how often you pee, you're tired all the time, or getting muscle cramps, a doctor is absolutely going to want to run a GFR test to figure out what's going on. These symptoms often don't show up until the later stages, which makes this test a really critical tool. So we know why it's used, but how does this test actually work? Well, the whole process is surprisingly simple, all thanks to a pretty clever calculation. See, trying to measure your GFR directly is a very complicated procedure. So what doctors pretty much always use instead is something called an estimated GFR, or just eGFR. It's a super reliable calculation that gives them the info they need without all the hassle. And getting your eGFR number is actually just a four-step process. First, a simple blood sample is taken. Second, the lab measures the level of something called creatinine, which is just a normal waste product your muscles make. Third, they plug in some of your personal data, like your age and sex. And finally, a special formula takes all that information and calculates your final eGFR score. That's it. And I really want to stress this part. The physical test is no big deal at all. The blood draw is super low risk, and it's usually over and done with in less than 5 minutes. A little pinch, and you're good to go. Okay, so you've had the test, and now you have a number. Let's talk about what those results actually mean, because this is where having a chat with your doctor becomes absolutely essential. In general, if your eGFR number comes back in the normal range, that's great news. It suggests your kidneys are filtering just fine and that you probably don't have kidney disease. Now, if your number comes back lower than normal, that could be a sign of kidney disease. It's an indicator that your kidney filters just aren't working at full steam. And a very low eGFR result, well, that's a serious red flag. It can be an indicator of kidney failure, which is a condition where the kidneys have pretty much lost their ability to function. And this brings us to maybe the single most important point about your results. As Medline Plus says, the eGFR isn't a perfect test. It's a fantastic tool, for sure, but it is not a diagnosis all by itself. It's a number that needs context, so you should always, always talk to your doctor to understand what it means for your health. It's really important to remember that the eGFR is just one piece of the puzzle. To get the full picture of your kidney health, your doctor is going to look at it alongside other tests and information. To get that fuller picture, your provider might also check for things like protein in your urine. That can be a sign of kidney damage, or order a BUN test, which measures another waste product in your blood. All these tests work together with the eGFR to tell a much more complete story. So, If you take away one thing from our explainer today, it's this. The GFR test is a super important, easy, and powerful way to check on how your body's amazing filters are doing. But it's almost never the end of the story. It's more like the first chapter that helps guide the next steps in protecting your kidney health. You know, every number in your health report tells a piece of your own personal story. And understanding what they mean is really the first step to taking control of that narrative. So the question I'll leave you with is this. What story are your kidneys trying to tell you?